You're listening to Dr. Erica Jones, MD. The universe needs conscious minds to observe it.
If you are losing your hair, just know that there may be many different reasons why. There are different types of hair loss, and there are different reasons why. So make sure you stay tuned to this video. I am going to talk you through the different types of hair loss. Just know that if you treat the wrong type, you're wasting time, money, and some things can even make it worse. So today's video, I'm going to break down the major types of hair loss, what they look like, and why that matters for treatment. I'm Dr. Erica R. Jones, MD. Make sure that you subscribe to my channel if you haven't already, and send this video to someone who may benefit. Now, hair loss is common in men and women, and it can show up in different ways. Sometimes it can just show up as like thinning on the top or like widening of a part. Sometimes the whole hairline just starts receding. And then there's other types where like hair just comes out in clumps, or you could have like a round bald patch. Now, there's a key difference and a key divide. There is non-scarring, where the follicles are still alive, and that can be reversible. Oftentimes it's reversible. Then there is scarring hair loss, where the follicles are destroyed. And a lot of times this is permanent without very aggressive treatment. So when you think about hair loss, a lot of times that is going to be like in a pattern, and the pattern is going to be driven by genetics and hormones like DHT. So in guys, you have like more recession like along the temples, and you have some thinning at the crown, and that may progress to like an M shape and a bald vertex. Now in women, you kind of have like a diffuse thinning like over the crown, and you might see like widening of a part, but usually like the front of the hairline is preserved, and this tends to be gradual and progressive over years. And it also runs in families. So talk to your parents about their hair loss and if they had any different types. Think about shedding. There's different types of shedding. Telogen effluvium, sudden diffuse shedding, and that's from all over the scalp. So a lot of times people will notice that like in the shower or on the pillow, and that's usually triggered by a stressor, maybe like 2 to 3 months earlier, like some type of illness, some type of like surgery, high fever, even like childbirth or like stopping some hormonal contraceptive. Also crash dieting, iron or protein deficiency can give you this. And then there's certain medications that can cause hair loss too. Now I'm going to talk about more about that in the next video. In this type, the follicles are not destroyed. So when you address the trigger, the shedding oftentimes is going to stabilize, and then the hair loss is going to improve over several months. So it's important that you reflect on what's going on. When you talk about patchy hair loss, think about alopecia areata. And a lot of times that's like some immune mediated, like round or oval, just whole bald patches. Sometimes people have total scalp and body hair loss. Then there's attraction alopecia, and that happens when people get braids, weaves, real tight ponytails, and it starts along the hairline and the areas that are under the most tension. There's scarring alopecias. There's different types of alopecias. Now, in this, what you might see is some redness, some scaling, and then maybe even like some tenderness to the touch. And early diagnosis is critical because it can be permanent. So just know this: if you are losing your hair, step one is trying to figure out the type of hair loss. So that way you don't just start using a bunch of random products. You can go to your dermatologist and get a targeted plan. So in the next video, I'm going to talk about some medications and some other triggers that may quietly or not so quietly sabotage your hair, contribute to hair loss. Once again, I'm Dr. Erica R. Jones, MD. Like this video if you found it helpful.